and welcome to the 7th meeting of the Massachusetts Cannabis Advisory Board Research Subcommittee. I apologize, I am on the phone today, so you will not be seeing my video. However, excited to have a really interesting and important discussion today, and thank you so much for the Research Subcommittee members for being so active. And I know we meet monthly, so I'm very grateful for the time and energy in this subcommittee. So calling a quorum, I'd like to call this meeting to order, and I believe we have roll call of Chief Carmichael. Are you present?
Yes, I'm present here.
Thank you so much, Chief. And we've got Amanda Rosatano.
Hi, here. Thanks.
Awesome. Thank you. We have Courtney Cleo.
Good morning.
Good morning. And we have myself. So calling a 4-member quorum to order. I'm excited to get this meeting off and running. Next slide, please. So today we're going to go through the meeting agenda and updates. And I'll say next slide. So slide number 3, Ernesto. So just a quick call to order. Welcome and comment review of the agenda today. I was unable to submit the meeting minutes from the last month's meeting in time for this meeting. So we will not be voting on that. But today our main discussion will be centered around, we'll have Commissioner Roy give it some updates as well, and then we will dive into the lab summary results and the discussion of some draft lab recommendations that we've come up with as a group. We decided in our last meeting that we would extend the public comment period from 12:15 to 12:55 today. So if folks do have comments, please put them in the team chat. And you can also email them to myself at marian@cannacenterofexcellence.org between the times of 11:10 and 12:45. And then we will move into addition of any agenda items and discussion of the next meeting. One note that I will put here is that one of our research subcommittee advisory board members will no longer be on our working group. And we are very grateful and thankful for her work in the past, and wish her very much good luck with the next steps moving forward. And that is Nicole Snow. So she is no longer part of our subcommittee, but we still maintain a quorum of 4 members, and we're waiting on the commission to assign new subcommittee members. Next slide. So just to catch everybody up who's in our subcommittee and also who is potentially watching online in the audience, we started our subcommittee last year. We're in our 7th meeting now. We meet monthly, and I'm really grateful to the subcommittee members for being so active. We were assigned as a subcommittee by the commission to review 2 main areas. We have 2 main tasks. One was to review the Commonwealth vertical integration requirement for medical cannabis treatment centers, and the second was to really brainstorm around long-term strategic planning for the Massachusetts cannabis industry, and what are some key areas of recommendation that we should provide to the Cannabis Control Commission and other advisory board members as the new as this year's regulations will be opened and adjusted. So next slide. So these are the tasks that we've been tackling as a subcommittee for the last 7 months now, 8 months. In our last meeting of February 3rd, next slide, Ernesto, we had a really great discussion, and we voted on cannabis research and medical cannabis recommendations. Those were developed based on a series of experts that we invited to participate and give presentations to our subcommittee. And we voted to pass those research recommendations with a few changes that we had discussed during our last meeting. So next steps on that is continuing to revise those recommendations based on our discussion and then submit that to Matt and the CCC. So I plan to do that very soon. Next slide. I apologize to the subcommittee. I was unable to develop the meeting minutes prior to our meeting with enough time for everybody to review. If that's okay, I will send the meeting minutes out after this meeting, and we'll have both the February and the March meeting minutes together. I'll stop there and see if there's any objections to that or any thoughts about what I've given updates so far for other members of the committee. All right, hearing none, then I assume that it's okay with the committee to send out the February meeting minutes in addition to these meeting minutes for our March meeting together for approval. Can I get a vote from our subcommittee that that's okay?
I'll move to approve.
Thank you. Was that Chief Carmichael?
That was Amanda.
Oh, Amanda. Thank you. Thank you to move to approve. And do we have Courtney?
This is Courtney. I'll second.
Thank you. All right. And Chief Carmichael?
Aye. Yes.
Awesome. Same with me. All right. Thank you all very much. Let's move along to updates from Commissioner Roy.
Good morning, everyone. Thank you, Dr. McNabb. And I just want to thank all of the members of the research subcommittee for all of your work and commend you for meeting regularly and tackling all of these important topics. As I do every meeting, I'll give you an update from the commission, and my comments may go a little long because last month, Dr. Balsam had inquired about an update around the driver's ed, the cannabis impaired driver's ed. So I will give an update regarding that as well. Let me begin. The Cannabis Control Commission voted unanimously at their February 9th public meeting to extend its COVID-19 orders that allow telehealth consultations for first-time medical patients, curbside pickup operations for medical marijuana treatment centers, also known as MTCs, and virtual community outreach meetings until December 31st, 2023, or until such a time the agency further modifies the orders. First enacted in the early days of the COVID-19 public health emergency, the Commission has extended these actions several times to ensure the health and safety of patients, MTC agents, licensees, and the general public throughout the pandemic. Since March of 2020, an average of 80% of all initial certifying healthcare providers visits were with first-time patients of the medical use of marijuana program were conducted via telehealth. In December of 2022, specifically, 87% of all initial provider visits were conducted via telehealth appointment. Additionally, 13 of the 100 operating MTCs continue to offer curbside services to patients. Now let me pivot to the cannabis impaired drivers education curriculum and provide you all an update per the request of Dr. Balsam. For the past year, Massachusetts Cannabis Control Commissioners Bruce Stebbins and Kimberly Roy convened and participated in a prevention and education working group to address the absence of cannabis impaired driving curriculum in the driving schools of Massachusetts. Chapter 55 of the Acts of 2017 required DPH in consultation with the Commission to develop public awareness campaigns that highlight effective youth prevention strategies and responsible adult use information. The working group was comprised of the following partner agencies and individuals: Massachusetts Registry of Motor Vehicles, Mass DOT, Massachusetts Department of Public Health, AAA Northeast, UMass researcher Dr. Jennifer Whitehill, Newton Police Chief John Carmichael, Commissioner Bruce Stebbins, and Commissioner Kimberly Roy. The goal of the working group was to address the lack of public safety prevention and education around cannabis impaired driving in the driving schools of Massachusetts. This is the first generation of young people to be licensed since cannabis became legal in Massachusetts. As the CCC continues to assess policies and regulations around the prospect of social consumption, the urgency of educating citizens about the dangers of impaired driving was a critical focus of the working group's efforts. The group's discussion reviewed and considered curriculum, unique tools, and resources for driving schools, and how best to approach the need for prevention and education in public safety. As a result of the working group's discussions, research, and recommendations, the Registry of Motor Vehicles adopted the Shifting Gears, the Blunt Truth About Marijuana and Driving education program as a module update to the current Massachusetts driver's education curriculum. It does include information on cannabis, including what is tetrahydrocannabinol and how marijuana affects the brain, physical effects, visual and physical reaction time, synergism, and information to motivate students to establish safe transportation to avoid impaired driving. The addition of cannabis to driver's education in Massachusetts took effect in January 2023. Previously, this module referenced alcohol and drugs overall, but going forward, the curriculum will include a separate section on cannabis impaired driving. The Commonwealth has 700 driving school locations that use the curriculum. Approximately 50,000 students a year attend classes at the state's driving schools. On January 12th, the Massachusetts Cannabis Control Commission voted to endorse this curriculum and is now listed as a recognized partner. It is official commission policy. The Special Commission on Operating Under the Influence also voted unanimously as presented in their January 2019 report to the legislature to recommend, quote, the Commonwealth should add a drug impaired driving module to the driver's education curriculum. That vote was 10-0. Two members of the Special Commission were on the working group, Mary McGuire and Chief John Carmichael. Chief Carmichael is also a member of the Cannabis Advisory Board and our research subcommittee. I am proud to say, since the start of the cannabis impaired driving school curriculum in Massachusetts, and Massachusetts was the first in the nation, 6 states have expressed interest and are moving forward. Rhode Island, Connecticut, Maine, New York, New Jersey, and Missouri are all interested in following the Massachusetts model. So I want to thank all of the working group partners, everyone involved to make this possible. And at the end of the day, this is about prevention and education and public safety with our young people. So thank you for indulging me and allowing to provide this update to the group.
Thank you so much, Commissioner Roy. Very much appreciate your work and your leadership, and thank you so much for that update.
Thank you.
Excellent. Very excited to learn more about the extension also around telehealth and access for medical patients. I think that's going to have a great impact. All right. Next slide, please. All right, now we're going to dig into the Cannabis Lab discussion and research results and recommendations. So slide 9, please. So to catch everybody up who might be on the call or online, we started discussing issues related to cannabis lab testing in Massachusetts back in October. We started discussing different issues that we had thought may be areas where we could provide recommendations, and decided that it was important to cast a wide net to get input from the industry from a variety of different perspectives about what recommendations folks have, what challenges people are facing, what recommendations do they have to change moving forward, and would they be willing to share additional input. So we launched a survey on Google Forms on October 20th and have voted several meetings to continue to extend the input time for industry here locally to submit ideas. In our last meeting last month, we had, I believe it was 35 responses, and we agreed that we would double down a little bit and try and reach back out between February and March through our networks to get more folks to give input. So I want to give a special shout out and thanks also to Amanda Rosentano, who really worked with me in the last month to kind of get more responses and to think through some of these results and prepare our slides for discussion today. So thank you so much, Amanda. So this survey, we sent it out asking for cannabis business owners, industry workers, consumers, patients, policymakers, and the general public to share their input. We received to date 56 responses from the survey. 48 were participants from Massachusetts and 7 were from outside of the state. And out of those, 10 participants said they'd be willing to submit video testimony for our group and make it public record, and 24 said they would consider it. Here you can see the survey link for the Google form. Next slide. So in terms of who actually responded to the survey, we had 56 respondents. The majority or the largest demographic of respondents were actually cannabis industry workers, with 34% of our respondents being a cannabis industry worker. About 6% were a cannabis lab business owner, 7% were cannabis manufacturing business owner, about 4% cannabis retail business owner, and about 13% cannabis cultivation business owner. We did have representation from patients, about 4% cannabis medical patients, about 4% from the general public, and we had 4% of cannabis business consultants that participated as well. We did have some policymakers as well. Next slide. So we prepared a summary document of these research results for each of the categories for the Cannabis Advisory Board Research Subcommittee members. So that was sent to you in advance of this meeting. That document basically has each question listed, each of the responses that we received. And what we did was come up with some themes that those responses elucidated. So for our first question, we asked, please describe in as much detail the main issues related to cannabis lab testing. Any kinds of comments were open and welcome. So the themes of the responses that we got back relating to the main issues were adjusting bacteria, mold, and yeast levels, regulations accounting for differences between good and bad microbes was a key theme. Lab shopping as a reality in Massachusetts was identified as a key theme and area for intervention. Low butane limits, really trying to understand and regulate or limit and understand remediation methods. Also issues related to sample manipulation and THC inflation and cost and turnaround time. Next slide. In terms of the recommendations that the respondents suggested, we asked them to provide any recommendations to the challenges or issues that you see facing lab testing, and then if possible to provide sample language or links from other states, examples. And some of the recommendations were to revise and review the testing for specific pathogens, again, defining good and bad, raising the butane level limits, implementing a secret shopper program and off-the-shelf testing, making testing data available to the public via open data, establishing state standard labs and testing SOPs, and then further digging into sample collection and how that's currently conducted to make it a little bit more representative. Next slide. We also asked an open-ended question for our third question. What additional changes to the regulations do you suggest? And most commonly, people reported issues relating to synthetic cannabis, really either prohibiting it, regulating it, or trying to understand having it on the label, but that was the most common comment. There were several comments around revising the labels, too much information on the label, not enough information on the label, and wanting to have certain elements on the label. So just general label review. Again, it came up about remediation issues, comments related to moisture testing, and wanting to have moisture testing as part of the protocol were included, adjusting microbial testing, pesticide limits, and then again, open data. Next slide. Oh, and that should be question 4. I know I didn't update that. But we asked in question 4 whether or not the respondents would support a Massachusetts Cannabis Standards Lab. And 59% of the respondents agreed that there should be a Cannabis Standards Lab in Massachusetts. So those were basically the high-level summary results of our survey. Over the last 4 months, I've had a number of conversations and received a number of other recommendations, and we're compiling those within the report for the committee. But it seems like a very important topic for us and our subcommittee to be addressing. So I appreciate you all being here today to discuss these draft recommendations. I'm not planning on us voting today, but rather to, review each of these recommendations and again, see if we need to provide any more, if we need any more background, if we want to change any of these. And then our thought was on our next meeting, make any related changes over the next month that we come up with today, and then vote on a final set of recommendations, hopefully potentially in April. So I'll stop here to see if anybody has any questions about the research findings and results, or any comments before I go into reading each one of the recommendations, which we have come up with 7 different recommendations, just so that the committee is aware. Any kind of initial feedback or thoughts around the survey?
Dr. McNabb, maybe it's just worth mentioning that, there were some, the reasons why, we're looking into this, taking a look at this, gathering feedback, making recommendations, is obviously the importance of lab testing for consumer safety, patient safety, product assurance in the marketplace, but also because there have been some reports of issues related to inconsistencies with lab reporting, inconsistencies with the way that products and flower is being tested and reported to consumers. So I just wanted to mention that, this isn't sort of coming out of the blue. This is, very much related to an ongoing conversation around what's going on with product testing and how that's impacting our consumers and our patients and our businesses in the marketplace. So just wanted to give that additional context.
Thank you, Amanda. I really appreciate that. Yeah, we did not come up with this as our own sort of come up with an issue to tackle, but really tried to look at what's happening in the industry and give thoughtful thought about the case we have on patients and businesses.
Yeah, and sorry, just to add to that, to your point, like, this is an incredibly complex issue and something that, I think you'll see in our recommendations, sort of something that we recognize that a lot of, additional information and research and data collection probably needs to happen in order for us to really make some of the changes that probably need to be made. And I think some of that is reflected in our recommendations today.
Yeah, thank you so much for that clarity. And background. Any other thoughts before we kind of launch into the recommendations?
Dr. McNabb, I'm sorry, go ahead, Chief.
Oh, you can go first, I'll wait.
Oh, thank you. I just want to echo Amanda and just remind folks that some of these issues that the subcommittee is grappling with today are not unique to Massachusetts. Many other states are addressing these same issues, if you will. And as I have previously stated, in the absence of a standards or a reference lab, that we have 12 ITLs, and our ITLs need to be good stewards and honest brokers, and to ensure that patients and consumers have accurate testing and safe products at the end of the day. So I appreciate the work that they do. And just as a reminder that, you know, at the end of the day, it's the testing that sets us apart from the legacy market, if you will, that patients know that their products are free of pesticides or mycotoxins or heavy metals. So this is a really, it's really important issue for the regulated cannabis market and in industry as a whole. And I appreciate your thought around this and you know, you tackling this subject. So thank you very much.
Yeah, thank you, Commissioner Roy. Chief Carmichael?
All right, thanks, Mother. Just more of a question. So in the existing dispensaries, do we know how much of these products, or if there are products making it on the shelves from out of state? And if so, I'm just thinking that, you know, we are obligated to make sure that the products are tested and they're safe for the consumer. And if this is the case, how will we kind of address that? Anything that might not make it through our labs here.
Yeah, that's a good. Go ahead, please.
Chief Carmichael, thank you for that question. There should not be any out-of-state products. It is federally illegal to have cannabis cross state lines. So everything should be grown in Massachusetts, cultivated in Massachusetts, and tested in Massachusetts.
Correct. I will back up Commissioner Roy on that.
That include, I know that, I realize it shouldn't be happening, but how certain are we that these products from out of state are not making it? And specifically things like, you know, some of the CBD, you know, say CBD gummies or something like that.
I'm happy to give some perspective on this from my experience, both operating a dispensary, a vertically integrated dispensary here in Massachusetts, and now sort of being in other markets like New York, where this is a really huge issue. You know, what we're seeing is we're certainly seeing products come in from other markets. What we're not seeing is those products in Massachusetts dispensaries, and I would attribute that to our sort of strong regulatory framework, our requirements to have those products tracked all the way through testing into the dispensaries, and the regulatory oversight of the CCC, which in this case I think is pretty strong when it comes to what products are on your shelves and are being distributed to patients. Where we're seeing these products from out of state is typically at unlicensed outlets, whether that's here in state. I know it's very, very prevalent, like in New York City, where there's plenty of unlicensed dispensaries, and they're sort of reckoning with how to deal with that right now as they launch a legal industry. But I personally don't see that as being an issue within our dispensaries. It's probably the one place where you can go to ensure that your products have been tested. And I think what we're looking at here today is sort of what is the quality of that testing, what is the consistency of that testing. But I feel personally pretty confident that that testing is happening if products are making it to dispensary shelves, and that our regulators are sort of doing their job and getting out there and getting into these dispensaries and checking inventory on a regular basis to know that these have been sort of tracked through the system from seed to sell, which includes a stop at the testing labs.
Okay, so my point being is that, so then are we saying, you know, and for the sake of argument, are we saying that we have 100% compliance in our dispensaries here in Massachusetts, that nothing's making it on the shelves from out of state?
I think that would
I
be.
think there's an important question that is maybe to put in here. So there's the cannabis side, the regulatory cannabis side, and Chief Carmichael, you mentioned CBD gummies. If there are hemp-derived CBD gummies, what we're discussing today is the cannabis testing regulations. So on the hemp side, on the CBD and hemp-derived, it's a little bit of a different, because that can cross state lines. Amanda, did you want to jump in on any of that?
I'll just add to that we've added a mechanism here in Massachusetts to allow our hemp farmers to sell their CBD products through the licensed dispensaries, which then covers sort of the testing piece of it as well. So again, I think where we're seeing most of the issues around these potentially unsafe products because they haven't been tested is really outside of the regulated market here in Massachusetts. I think anyone would be hard pressed to say that there's 100% compliance in the industry, but my understanding is that the compliance issues are more related to testing procedures and how the tests are being reported back to customers, rather than whether or not they're being tested, because it's just very difficult to get them on the shelves without passing that, to get them in your system, right? So it would essentially, people would have to be selling stuff outside of the system, which is possible, but not really something that I think has been a big problem in licensed dispensaries.
Right, so I understand the whole process. I know how everything works. I understand the law and everything. I'm just putting this out there so that when we're saying that we really want to have these standards in place, that we do, that everything is tested and safe before it gets to the consumer, and we just feel very confident about that. And I was always a very big supporter, as a member of the Cannabis Advisory Board, of things like the secret shopper thing, which is on one of the slides, and basically purchases and enforcement of the dispensaries, and making sure that everything on the shelves, and being confident that it is all tested and meets the right standards that we're trying to meet here in Massachusetts. So that's just why I bring it up.
Yeah, awesome. Thank you so much for bringing it up. I think it is it's a very important points that you're making, and yeah, really excited that the secret shopper is one of the main recommendations that we want to promote. So any other thoughts before we dive into the reading out the draft recommendations? All right, hearing none, then why don't we just kind of dive in? So recommendation, we have 7 recommendations that we've come up with. First one, that's recommending that the CCC should expand the current existing open data portal to include open metric data related to lab testing. Data points to include, but not limited to, THC potency, fail rates, and other COA info, certificate of analysis. Similar to lab standards, have clear guidance and standards for operators in reporting their levels of THC or other cannabinoids. And that kind of leads into recommendation number 2, which is define THC, which is what is total THC, THCA, THCV, THC, etc., and provide operators clear guidance on how to appropriately calculate and label their THC for the benefit of consumers. And I would also almost add other cannabinoids, but we won't for now. Recommendation number 3, next slide. Because lab testing is such an ongoing topic of discussion, and as Commissioner Roy mentioned, not just in Massachusetts, but statewide, in many, many states. The third recommendation is to convene an ongoing working group similar to the model in Colorado to review and make ongoing recommendations on the rules and regulations related to the testing and labeling of cannabis and cannabis products. and then to advise on current testing protocols and labeling. And the reason why we recommended this working group is that there are a lot of key areas for discussion that I'll talk about that we felt like would be more beneficial for a group of experts to be able to contribute on an ongoing basis. This lab testing is one topic of many topics of our subcommittee. So in order to kind of continue the discussion moving forward, we thought it would be good to, and I have not been able to get the exact regulations of and the language of what's happening in Colorado yet, but hopefully we can over the next month. Basically try and figure out what's the exact structure of that professional working group that is happening in Colorado. But some key areas for discussion of this working group is to update the CCC finished product sampling and analysis protocol, which is the quality assurance protocol of the CCC. There might be areas of sampling and updating that protocol that may be helpful for the industry. To improve the chain of custody monitoring and rules for sample size and selection of samples. There's some interesting approaches from Colorado that were adopted around batch size and selection that I think could be relevant for discussion for this working group. Next slide. Again, other topics for discussion for this working group can include the quality assurance program plan for analytical testing laboratories that I mentioned. Again, the Colorado working group structure, critically review the limits and methods for testing microbiological contaminants, critically review and monitor for harmful byproducts in the growth of mold cannabis flower that remain after sterilization and remediation. Critically review the list of pesticides to test for in the state of Mass, recently released by MDAR, or review the parts per billion limit. Next slide. Recommendation number 4 would be for the Cannabis Control Commission to conduct quarterly audits of existing labs. So for the CCC to hire inspectors with science backgrounds similar to skill sets of the EPA or FDA audits. Enforce regulations and protocols and collect feedback and data from labs to support ongoing improvement. Recommendation number 5, the CCC to commence a feasibility study around the implementation of a cannabis standards lab in Massachusetts, using lessons learned from other states that are implementing cannabis reference or standards labs. And those other states include California, Michigan, and Maryland. Next slide. Recommendation number 6 would be to start the secret shopper program that is part of the existing Cannabis Control Commission regulations. Really, that is under 500.303 under the existing regulations, which is entitled Unannounced Purchase for Purpose of Investigative Testing, or the secret shopper program. Suggested to use off-the-shelf testing of cannabis products to monitor the experience of the consumer, potentially explore round-robin testing where correlated results are built in like a proficiency. Next slide. Our final recommendation is to amend the testing requirements to modify the current microbe thresholds under 935 CMR 500.160, the testing of marijuana products, tests only for specific harmful pathogens. Currently, requirements set unnecessary thresholds, harming organic and outdoor farmers from being able to cultivate ideally, the problem being distinguishing between harmful and helpful microbes. So the idea is to support a petition filed with proposed language and justification for the changes that looks like it's been filed in 2020. Next slide. So those were the 7 recommendations that we came up with. And now I will, it seems like we've gotten to our public comment and our discussion period a little bit earlier than anticipated. So next slide. If people in the audience, online, and the public have comments, they can put them in the live Q&A Teams chat, or you can also email them to me, and that is my email address, on the screen, and I will be monitoring my email as we continue to discuss in case there's any technical difficulties of people putting in comments in the Teams chat. So I'll stop there and maybe open it up for discussion.
Dr. McNabb?
Yes.
I just want to say thank you so much for that presentation, and also to let folks know that our testing department at the commission is in the process of expanding. These jobs are, if you go to our social media, you will see them posted for laboratory and testing analysts. So that is good news that our department in our testing department is growing. And as in regards to the secret shopper program, which is stated in our regulations, that can happen at any time. It can happen. The commission has can execute that when they feel necessary. It has been done in the past, and it can happen in the future. And the key word being in the title, secret, right? Secret shopper. So, you know, and that is to ensure and uphold public safety, public health, public welfare, and make sure our products are safely tested. So, I don't want folks to think that our investigations and enforcement team have not executed that in any way, and it's up to their purview, but it is in the regulation. So I appreciate the discussion around it, and we're very mindful of that. So thank you very much.
Thank you, Commissioner Roy. I really appreciate that update, and I'm really excited to hear that the team is expanding at the CCC, and that, you know, the secret shopper could turn on because it's already in the regulations.
Yeah.
Any other thoughts?
I will just, Dr. McNabb, this is Amanda. I'll just add, you know, I'm generally supportive of the set of recommendations that we're putting forth today. I wanted to make a comment on the working group that we're recommending. You know, I think that the CCC has been open to taking comments, feedback, not only from the public, but from industry groups, from patient groups. And I think, you know, they've been pretty good about keeping that dialogue and that communication channel open. But I think what we're trying to do here with this idea of a working group is sort of create some sort of foundation for having an ongoing conversation with representative stakeholders from across the industry. And so I just wanted to recognize sort of the work that does go into, you know, taking feedback from, you know, a lot of the different groups that exist, and those conversations, I know because I've been involved in them, do happen at the CCC level, and just sort of clarifying that what we're trying to create. Sometimes it's hard to pull everybody together or to get, you know, the full scope of what's going on, because you have individual groups, whether it's, you know, the industry associations or the patient groups, the patient advocates or whatnot. You know, we have all these different groups kind of coming and giving feedback, and then similar to what we're doing here with the Cannabis Advisory Board, creating sort of an ongoing working group to be able to take on some of these issues and to give ongoing regular feedback to the CCC. So I just wanted to mention that sort of was the thinking around that, that piece of it.
Thank you. Yeah, I think that's, you know, very helpful background, and thank you for sharing that, because yeah, and the Colorado working group was, I believe it was, you know, kind of somehow attached to their regulatory body, in the sense of like, we're a Cannabis Advisory Board. It's my understanding that this group was also formally somewhat recognized in that way, so it's not just but there are there's, you know, I think it would be very important because there's so many issues to tackle, and having a representative group of industry supporters would be really helpful. In the meantime, since our last meeting, a cannabis lab association has been formed in Massachusetts. Amanda, are you aware of that?
I was not aware of that.
Is anybody else aware of that? So I'm just trying to pull it up here. There is a new industry working group, industry association that's been formed, and several members of the lab are joining it. I don't know if we want to kind of include that as part of our recommendation, or just note that there's an industry group that's forming.
Dr. McNabb, I am aware of that, and thank you so much for bringing that up. And I believe they have been in contact with the CCC directly as well.
Okay, great. Yeah, do we think that that might be a good vehicle to add as a sub-bullet as maybe one area of work for this working group?
Yeah, or a group, a stakeholder group that we might want to think about including.
Yeah. Awesome. Any other comments on our recommendations? And maybe I'll stop to see if the commission, is there any public comment?
We do have some public comments, Madam Chair. I'm happy to read them.
Awesome, thank you
First,
so much.
of course. The first is the question, is there a public link for the recommendations yet?
There is not, because this is a draft that we are discussing. But if the committee feels, if our subcommittee feels okay with publishing these draft recommendations on a public link, I'm fine with that.
Dr. McNabb, do you think maybe you should wait till you vote on them? I'm just throwing that out there.
Yeah, okay. So I think that is probably correct because we will be making, is there any issues with publishing our draft so that over the next month, if people have comments on it?
I think it would be fine to get any feedback that folks had on the draft. I think it would just be supplemental to the feedback that we got through the survey. And maybe it helps us to refine these a bit if necessary. I'm open to that.
About publishing drafts now so that we can get additional input. It'd be labeled very much as draft for discussion. Do we have a motion to?
Dr. McNabb, do you mind if I jump in real quick?
Thank you, Matt.
Yeah, sorry about the echo. Yeah, so the commission generally does not post draft materials for Cannabis Advisory Board meetings. However, that is something that we could explore. I just want to be mindful of the logistics and timing that might be involved in something like that. So just to kind of level set for everyone that it might not be an immediate posting if that is the direction folks want to move in.
Is it something that Dr. McNabb, as the chair of the subcommittee, could share a link to or something publicly? But does it need? I'm just curious in terms of mechanism for sharing. Does it need to come through the CCC?
That's a good point. Yeah, no, absolutely. It's I don't believe it has to go through the Cannabis Control Commission's website. So if there are other ways in which the subcommittee wants to share materials, I think that should be fine.
Okay, great. So I would be willing to, at least post this as a draft and maybe in the next month have another survey of people giving any recommendations on those drafts. The reason why I'm, I guess, leaning more towards this is because this is such a large topic for the industry, and I know we only got 56 responses, so we'll have one more month or so to be able to gather input. So I'd be willing to post it out and then develop up another survey that says any recommendations on, or any, thoughts on our draft recommendations, and, sunset the first Google survey, but create another that back. Anybody have any thoughts on that?
Do you need a motion?
Anybody have? I don't know if I need a motion. I guess. Are there any objections? Yeah, let's do a motion. A motion for maybe members of the subcommittee of the Cannabis Research Subcommittee to develop a new survey asking feedback on the recommendations that we've presented here today, and the ability to, on a non-CCC website or outreach, share the draft recommendations for comment.
I'll move to share the draft recommendations via some sort of public link or something.
Thank you. Do we have a second?
I'll second.
Thanks, Courtney. I vote aye. Chief Carmichael? How do you vote?
Yep, aye.
Awesome. Cool, thank you. All right, we will move to
Dr. McNabb, I
Yes.
think that Courtney and I are still supposed to vote.
Okay, yes,
No,
thank you. Can I get your vote, Amanda?
Yeah, aye, thanks.
Awesome, thank you so much, Amanda. And Courtney?
Aye.
Thank you. Great, so moved. All right, what's the next comment?
Next, we have a comment. There is an inherent challenge with, quote, off-the-shelf testing, as the products that have been on the shelf for 6 months are not going to test at the same levels as when they first are on the shelves, specifically potency.
Yes, and that's a really important point. And the 1-year expiration on these tests, I've been thinking about that quite a bit, personally. What are other thoughts about? I mean, that is a very big challenge, because, and also about the 1-year expiration date, so to speak.
Next, we have a comment from Dan Delaney from the Association of Cannabis Testing Laboratories. A critical component of the Secret Shopper program is to have some way of publicizing outcomes of the secret test. This will reinforce the deterrent effect.
That's a really great suggestion.
Next, we have another comment. Perhaps this working group should also include the newly formed ACTL.
Yeah. Which is the Association of Cannabis Laboratories. Did they spell out ACTL?
Correct, ACTL.
Did they spell out what that acronym is? Because I'm non-familiar.
The Association of Cannabis Testing Laboratories.
Okay, cool. The new one in Massachusetts.
Next, we have a question. Has there been any consideration of process validation for licensed entities? I know that this is part of the CO testing regulations, Colorado testing regulations.
Ernesto, can you repeat that one, please? Thank
Yes,
you.
of course. Has there been any consideration of process validation for licensed entities? I know that this is part of the Colorado testing regulations.
I can just comment that process validation is not something that we've included in our recommendations, because, but I would say that it's also not something that should be overlooked as an important issue for the state to look at. I think personally, there's a lot of opportunity in taking a look at process validation, and really reducing some of the operational burden cost on operators, while also ensuring that there's effective processes in place to make sure products are safe. So I don't think process validation doesn't replace lab testing, but it does kind of streamline the process a bit for operators. And I would just agree with that being something that should be looked into.
Awesome. I wonder if the person that put that comment in the public chat would be willing to go and help us find the exact Colorado regulations and point us to where we can see how that's structured. Because I think it is an important piece. Does anybody else have comments on this question? So perhaps we should look into this if anybody can point us to regulations in Colorado, and we can. Amanda, do you think that this should be a point where we create a new?
Dr. McNabb?
Yes.
I was just gonna say, I mean, separately, the FDA has definitions around that as well. But yes, I'd be curious to see the Colorado version of that as well for process validation.
Dr. McNabb, to answer your question in terms of whether or not we should include process validation as a recommendation, I personally hesitate to recommend that as a state we do this process, as opposed to maybe that being one of the issues that the working group looks into or digs into deeper. It just seems something that we don't want to rush a recommendation on, and we want to really make sure we fully understand before. But my understanding around this is essentially, this wouldn't replace cannabinoid test, batch testing for cannabinoid content or anything like that. So you know exactly what you're getting every single time, but it would allow operators to have their processes for cultivating, for example, the nutrients, the fact that they're not using pesticides, be validated, and so that it could potentially cut down on some of that pesticide batch testing or other testing that needs to happen. So I just don't feel strong enough personally in this to be able to put a recommendation together yet. But I think it is something that we should be looking at in the context of reevaluating the testing, the broader testing protocol, the QAP that we're talking about, and that being sort of a piece of the bigger review. That's what I would recommend.
Perfect. All right, we'll add that under the working group, and then we'll hope that whoever gave that public comment will send us more information. There's my email, and we hope that you would. Cool. Ernesto, any more?
No more comments.
Okay, I have received two comments in my email. One is requesting for the draft recommendations, which we already voted on and said that we would be able to share the draft. The second one is from, I do not have the actual name of the person, sadly, but I'm just going to read the comment from my email. This is not yet a well understood list of cannabis pathogens of concern, but in addition to E. coli and Salmonella would include Aspergillus, Penicillium, Fusarium, Staph, Mucor, Candida. It will be an exhaustive list and will be very expensive to provide. So I think that's an important point when we're distinguishing between good and bad. We want to make sure that we're testing correctly, but not being onerous on the operator, but still being mindful of patient health and safety. So I don't know if Amanda or anybody else has comments on this particular comment I received tonight. For me, I would say let's add this in as a topic for the working group that we're proposing, who might have much deeper thought around this? Open it up for others. All right, well, I will just go ahead and I think we should just go ahead and add that to the working group list of topics to discuss. Now I know that we had publicly mentioned that we would be doing input from 12:10 to 12:55, and we've really fast forwarded our agenda. And there's no other comments on your end, Ernesto?
That's correct, Madam Chair. No more comments.
Okay. There's no other comments in my email. Are there any other thoughts about the overarching recommendations that we've come up with from any of the advisory board members on any of the recommendations? Okay, hearing none, then let's go ahead and move on. So I guess as a good next step for these recommendations, they are still draft. We've discussed a few things that we want to add. Thank you to the public for giving any comments. I think what we'll do is, as we agreed, we'll take the recommendations as they are now. I'll create a public link and a feedback form for people to continue to have ongoing input over the next month. Our goal is to accomplish voting on these recommendations next month. So we'll be spending time in this next month to kind of round these out. All right. And thank you. I just got an email from Melissa, who submitted the question concerning process validation. Thank you so much. And thank you for assisting and helping us get more information about that. Those are all the emails that I have in my inbox so far. So does that sound like a reasonable approach, that we, take some of these comments that we've received? If anybody else on the committee has any thoughts over the next month, I'll basically set up a Google Doc for us with these recommendations that we can continue to revise to come up with a final one for vote next month. Does that all sound okay? Do I have a motion to move to approve that approach?
I'll move to approve the approach of voting on these next month. Is that?
Yep.
Okay.
Second.
All right. I vote aye. Courtney?
Aye.
Chief Carmichael?
Aye.
Thank you. And Amanda?
Aye.
Great. Awesome. All right. Next slide. I know that we've been meeting monthly, and I really appreciate everybody's time. I know this is a big commitment, so I really appreciate folks on the committee. I wanted to propose that we have our next meeting on April 8th at the same time to vote on our lab recommendations. And then, sorry, Ernesto, next slide, because you may be on slide 22. I'm watching a little bit delay. Yeah, perfect. So one of the things so far, I'm really grateful to the committee. We have passed two sets of recommendations, one related to veterans' health and access, the second related to cannabis research and medical cannabis. And this will be our third, which is around cannabis lab testing. But right when we started our committee, we also had discussed medical cannabis deverticalization. And I don't believe that we ever really voted on we did vote to say, hey, there's the industry subcommittee that came up with these recommendations and that we agreed with those recommendations, but we never really substantively have created our own recommendations from our subcommittee. That was one of the 2 tasks that we were assigned to do by action. And I just wonder, I want to hear from the group whether or not we feel like we need to develop a unique set of medical vertical integration recommendations, and that might take the form of just adopting the other subcommittee's recommendations and adding our own. But I figured if we all feel like maybe in the next meeting we could tackle both voting on lab and potentially discussing any vertical recommendations and moving those along. So I'm going to open it up for thoughts.
Dr. McNabb, is it possible to circulate the other subcommittees' recommendations on this again? I'd love to take another look at those. I feel like if they're in line with our recommendations, that it probably makes the most sense to just recommend the adoption of their recommendations or something like that, so as to be as consistent as possible. I think, aligned as possible, I guess, if there is alignment, as opposed to creating 2 documents that are kind of saying the same thing. I think it would just land a little bit better. That's my 2 cents, but I would love to just have the opportunity prior to the next meeting to get those recommendations for us to, review them independently. And then maybe we have a little discussion on if there's anything we need to add at the next meeting before we adopt or not adopt their recommendations.
And yeah, recirculate, get those top of mind. Matt and Ernesto and Commissioner Roy, do you know if any other subcommittees have been reviewing and produced any recommendations outside of the industry subcommittee?
Hi, Dr. McNabb. Yes, the Public Health Subcommittee has forwarded some recommendations to the full Cannabis Advisory Board that have not yet been taken up by the full board.
Okay, yeah, would you mind resending those to us as well? So we'd be looking at the public health and the industry ones.
Sure thing.
Thank you so much.
And can I ask Matt if there is a plan, if there is a full advisory board meeting scheduled or in the works?
It has not been scheduled just yet, but I anticipate that there will be one somewhat soon, because the commission is embarking on its regulatory review work now, and the Cannabis Advisory Board plays a critical role in developing those recommendations to share with the commission. So I know that the commissioners are getting antsy to get those recommendations to review. And so that should be coming on to folks' calendars in the very near future.
And Matt, do you guys schedule those full advisory board meetings? Who's responsible for coordinating those?
Yeah, we'll look for some times that work best for everyone and for the executive director as chair of the board, and we'll probably send out some holds, most likely.
Awesome. Thank you.
Cool. And could I also ask a question? So we've submitted not yet, but we submitted the veterans recommendations, and then we have our research recommendations that will we voted on, and then we will have these labs. So then is the process then, has the full Cannabis Advisory Board already received our veterans recommendations?
No, they would be reviewed at the next Cannabis Advisory Board meeting.
Okay, so maybe helpful for the other advisory board members, we could, as a research subcommittee, kind of package up all of the different recommendations that we've come up with.
Yeah, absolutely.
Okay. Do you have a sense that meeting will be in the next 3 months, or we're not sure?
Well, I can't say for sure, but we're certainly working on looking for the best times for folks' calendars.
Cool. Anybody else have any other thoughts about, the medical deverticalization? I think that's a good next step, that we review both the industry and the public health recommendations and come to the next meeting with any additions or changes.
I'm good with that. I just wanted to call out, Dr. McNabb, that I think that April 8th is a Saturday.
Okay, all right, so I definitely don't want to do Saturday.
Not ideal. Maybe it was
Not,
6th or the,
that was an over. How about April?
you cut out after April, so I didn't hear what the date was that you suggested.
Sorry, I was, April 7th, could we try for April 7th? From 11 to 1?
Fine by me.
Works for me too.
Chief Carmichael, does that work for you?
Yes, I think that's a good idea.
Perfect. All right, great. So our next meeting will be April 7th from 11 to 1 p.m. We're going to vote on lab recommendations, discuss medical vertical integration. Perfect. The last little bullet up here was animal health. We did discuss way in the beginning if we wanted to tackle animal health. And I'm curious if that should be our next topic or if others have other topics that they feel would be good for our subcommittee to provide recommendations.
I know one of the things we had also flagged in the beginning was talking about adolescent use and some issues that have popped up around concentrations. Would love to explore digging into that as well.
Excellent. I think that is a very important topic. And all right, good. We will add that as a, do you have any background materials or any other kind of documents you'd like us to all start looking at and thinking about as we dive into those discussions?
So I don't at this time, but I will reach out to a couple of colleagues and we'll circle back to everybody on that.
Awesome. Okay, cool. That would be great. So maybe at the next meeting, we can reserve a little bit of time if you want over the next month to kind of work with colleagues and think about some areas for our discussion. We can save some space in the agenda to talk about that.
That would be wonderful. Thank you.
Yeah. Okay, cool. Let's get the conversation started. Awesome. Do others have other topics that they want our committee to tackle? All right. Well, be free or do folks, do you want to talk? I think, maybe we, are folks interested in discussing animal health as well? In addition to, we're obviously adding adolescent health and prevention.
I'll just say that I think it's an interesting topic. I'm not sure where it ranks in terms of priorities for regulatory changes or anything like that. I think if there were folks who could, bring some information forth, experts or anything like this on this topic, I think it's interesting. I just struggle with it being sort of a priority given where we're at with other things, but that's my 2 cents.
Yeah. Kind of agree with you.
I love animals, don't get me wrong. I know I'm gonna get like violent emails from like the dog lovers, but I just think that like we just have such critical things to address that this is a little bit secondary in my eyes.
Yeah. Okay. Yeah. I mean, I think adolescent health and prevention probably might take priority over animal health. But what I think it is an interesting and important topic. I think one area of regulation is that animal products are only, I think it was, and correct me if anybody else at all, I might have to, refresh my memories this next month, but that's the only way that animal products search license or something like that. There's something related. There's a limiting of animal health. I don't know if anybody else has any other. I'll do a little bit more research in the next month. How about that? And see where the sticking points are. Okay, well, that's great. We've got our new meeting for April 7th. We'll vote on lab. We'll start discussing adolescent health and prevention, and we'll discuss the, after we've reviewed the other two public health and industry subcommittees, we'll talk about deverticalization next month. Is there any, maybe Ernesto, any last comments online? I don't have any comments in my email, and if there are none, maybe we can move to end our meeting early this month.
There are no comments on the Q&A, Madam Chair.
Great. Anybody else have any? Oh, here we go. I've got just received the 2022 Colorado regulations that we referenced and discussed in this meeting. Thank you so much, Melissa. So I will send those along to the members of the subcommittee that we discussed, that we talked about. It was just basically the process validation. So thank you so much. We've received the Colorado, pointing to where it is in Colorado. All right, well, thank you all so much. I really appreciate it. Does anybody have any last things they want to cover today? If not, maybe have a motion to end the meeting, close the meeting.
I'll move to close the meeting.
I'll second.
Thank you. All right. I vote aye. Chief Carmichael,
Aye.
Amanda,
Aye.
and Court.
Aye.
Awesome. Thank you all so much. I hope you have a wonderful weekend. Happy Friday, and get out there in the sun today.
Thank you.
Thank you.
Thank you, Dr. McNabb. Thank you, everyone.
Thank you. We'll see you next month.